Hello, everyone. Welcome. This is, if we could go back to the English slides, this is an announcement from the Language Justice team for this session about how interpretation is going to work. So today we are interpreting using the Zoom interpretation function. The interpretation feature is already activated. To choose a channel, if you're using a computer, you'll see a globe icon at the bottom of your screen with the word interpretation. Please click on it and choose your language, whether it's English or Cantonese. Next slide, please. And if you're joining via the smartphone app or a tablet, you're gonna look for the three dots where it says more, tap on it, select language interpretation, choose your language channel, and then click on done. That's what activates the function. And everyone, please select a language channel. Unless you are fully bilingual in English and Cantonese, you have to choose a channel today. And we're about to do a test on the channels. I'll pass it to you, Vicky.
Okay, thank you. Amanda. Good afternoon, everyone. It's a real pleasure to be here with you today to speak about how you can include children who have medical needs into your family childcare home while maintaining the health and the safety of all the children that are in your care. During this presentation, I'm going to ask that you keep paper and pen next to you so that you can write down any questions that you might have. If for any reason the questions do not get answered by the following couple of slides, I will pause periodically and give you an opportunity to write your questions into the chat box. We will be taking the questions in Cantonese and in English from the chat box, and periodically I will ask Amanda to facilitate and give us the questions out loud so we can answer them for everybody together. So as we get started, one of the most important elements of today's seminar is to know why it is important to include children who have medical needs into your family childcare home. In order to do so, we are going to review the legal requirements that as an FCC owner and operator, you need to know in order to be inclusive and include much information about health and safety guidelines, as well as processes that you need to have in place. Some of the elements that we will address today are for your family childcare homes to have a medication plan written down, which is different from an incidental medical services plan. So when you hear me reference IMS, that's an incidental medical services plan. Just in case I slip, I try not to give acronyms, but in case I make a mistake, that's what it will be. We're going to start with the legal basis in the United States about the rights of people with disabilities. And the federal government Americans with Disabilities Acts, or ADA, is federal law that states that even privately run childcare settings must abide by the law that prohibits discrimination based on disabilities. Medical conditions like asthma and diabetes are considered disabilities. Why do we need to know this? Is because families of children who have medical needs or other established disabilities have the same need for childcare as do other families so that they can go to work. However, families of children who have medical needs or other disabilities often find the search for quality and affordable early learning and care a greater challenge because they face reluctance from the providers to enroll their children. So this makes it all the more important today that as early learning and care providers, you make every effort to include all children in your family childcare home so that we do not add to the immense challenges that families already have. Now, what does the ADA say about when you as a family child care provider may be able to legally not accept a child into your care? Basically, you are expected to make modifications unless you can prove that accepting a child would cause a substantial risk to other children in your care, or that the changes that you would need to make would require you to significantly change the way you operate your program. For example, if you have never provided care for any children who need diapering or assistance in the bathroom or learning personal hygiene, and you never will, and you have a parent who has a child with a disability that would need help with personal hygiene, that would mean that you would need to change your entire program in order to meet this child's diapering and toileting needs. Doing so may require you to add staff and to start admitting other children who might also need to have diapering needs. This could be considered as a fundamental alteration to your program. And again, the question is could. Okay? It could be interpreted as a major alteration. The next part of this law says that you have to provide those alterations and accommodations unless they cause a significant difficulty or expense if you carried them out. Now, expense itself is not a legally sound defense to not admit a child into your care, because it is the expectation that the additional cost, if you were to need additional personnel, would be split amongst all of the families of children that are in your care. As far as the facilities or your family home, you generally must make the facilities accessible for children and families who have disabilities as you would whenever it is readily achievable. That means that it is carried out without much difficulty or expense. So keep in mind, it's not that it is the modifications and the adaptations you can make are cost-free. It just says that if they can be accomplished without much difficulty or expense, then you must accomplish them. So here's a little bit more about what the American with Disabilities Act specifically addresses as far as services that cannot be used to deny services. If you are a family child care provider, you cannot deny services if a child needs medication or diapering. Okay? If the program never, ever, ever assists any child ever with diapering or toileting routines, or you have never, ever, never will give any medications, then you might think, well, I'm not treating that child any differently from the others. However, the way this is stated in the law, this does permit the exclusion if this would significantly change your program. And this is a very important area to understand, that if it is an adaptation that is considered something that you could make or you could do in your program, such as diapering and giving medications, it is very common to do that in family child care homes, then you cannot deny acceptance or admittance to a child who needs the medication or needs diapering. And again, I have to add that higher costs are not a valid reason to discriminate and exclude children from a child care program. The extra cost is expected to be treated as overhead to be equally divided amongst all of your customers. So the title of this presentation is medical conditions. So are medical conditions considered disabilities? So within the context of federal law in the US, some medical conditions are considered disabilities, but not all disabilities are considered medical conditions. There are specific laws to determine disability for different types of government programs. So there's the Social Security Assistance Program that defines disabilities one way. The education system for special education describes disabilities a different way. For today's presentation, we are considering the medical conditions that are considered disabilities as defined for the American with Disabilities Act, which is assuring that every individual has access. In the case of the conversation today, access to childcare in your home. We are not going to be talking about special education services in schools or very specific disability determinations and conditions of children. We are really going to be concentrating the conversation on medical conditions and how you can make sure that whenever you give medications at your family childcare home, and in addition to the regular administration of medications, you also need to provide other medical services, that you know how to do so, and that you take all the precautions and have all of the resources available at hand. So this list really just speaks about the medical conditions, because many of you have already served children who have serious allergies to specific foods or bee stings. You may also have children in your care who have asthma. If any of you have children in your care for whom you are providing medications or any medical needs, please feel free to just write in the chat what type of services or medications or medical conditions you are already experiencing in your family childcare home. Just feel free to write in the chat, and that way everybody who is participating will be able to know the type of experience that you have. And thank you, because our translators will be translating also anything that is written in Cantonese and anything that is written in English into Cantonese so that everybody can participate. Well, we have somebody who is sharing that they are diapering an older child, probably because of some needs. Tube feeding, we will be talking about tube feeding in a little while. Autism is not necessarily a medical condition. It is a disability, however. And I will be talking about all of the forms that you need to legally be able to give breathing treatments for asthma, which is a very, very common condition. So these are some of the conditions that I have mentioned before, and I am going to briefly talk about these. These are the most common conditions in young children: is life-threatening allergies, diabetes, asthma, epilepsy, or some kind of disorder with convulsions. Cerebral palsy. Cerebral palsy causes a motor delay. Sometimes they can't walk without a walker. They may be in a wheelchair. That in and of itself is not a medical need, but many times children who have cerebral palsy also need to have breathing treatments or to be fed through a tube, depending on the extent of the disability. And if they need those other services, which also applies to children with Down syndrome, you might need to provide a higher level of medical services, not because they have epilepsy or cerebral palsy, but because of the medical needs that they might have, Sometimes you have children that do not have another disability with a name, but might need to be tube fed or might need to have oxygen because of an accident or maybe a significant medical history when they were born. If you already provide medications in your family childcare home, you already have a process for about half of the elements that we're going to speak about today. However, when I continue this presentation, I want to make sure that you all know that there are many resources, and even if you have processes in place, this gives you an opportunity for checks and balances to make sure that what you are doing is in alignment to the law and to the health and the safety of every child. I'm going to go to the other side of the spectrum, and after so much mention of legal and specific elements of inclusion, I also want to go back and review the why and why it is important for children to have access to early learning and care settings, particularly in your family childcare homes. Family childcare homes that support individual differences and provide access to children with special needs create an environment where all children feel included and valued as a necessary part of ensuring that all children receive developmental and learning opportunities so that every one of the children in your care can reach their full potential. You in your family childcare home are allowing then all children to demonstrate their strengths and their skills by providing that environment where they learn to appreciate each other with their strengths, their cultures, abilities, and needs. In admitting children who have medical needs into your family childcare homes, you are supporting the rights of all children to fully participate in their community. And you are creating inclusive environments where children can interact with and befriend other children who have diverse backgrounds and abilities. So here are a few basic elements to consider before you agree to enroll a child who has a medical need or other established disability. When I say before you enroll, not saying that to decide a yes or a no, but because you need much information about the child from the family before the child is actually dropped off with you and a contract is completed. You need to take time to meet with parents to get a deep understanding of their child's medical needs and how they address them at home. If at all possible, if they ever drop off the child with a relative for child care, how do they teach the aunt or the grandma about caring or giving medication to that baby? As you speak with parents, it is always, always best to acknowledge the child first and the condition after. For example, I would never say, I know how to take care of asthmatic children. Instead, I would say, I know how to take care of children who have asthma. First the child, then the condition. This is called people's first language, and it makes a difference to parent, and it is going to make a difference in all of the relationships that you have. Finally, remember to ask parents questions about any medical personnel that is involved with their child's care, and let the parents know that before the first day of attendance, you are going to need forms to be completed that have to be signed by their healthcare professional, because you want to have as much information about the child as you would ever need to make sure that you can provide a safe and thriving environment for all the children. So why administer medication at childcare? So we need to consider that medication schedules and parents' work schedules do not always match, so that parents can provide the medications only at times when their children are with them at home and not with you. So if you have a medication policy where you can actually write down when you have your contract, and your medication policy can say, I will only administer medications in my family childcare home when the schedule doesn't allow for the medications to only be given at home. So if a child is in your care for 10 hours a day and they have to take a medication at 12-hour intervals, it is very possible. And because it is in your admission policies, you can tell parents, please give this medication at home because you can work the schedule so that I don't have to do it. If the medication is every 6 hours, or if the child has asthma and may need to use an inhaler, given specific situations of when he's not breathing well, you're going to have to do it at your family childcare home because you never know when that is going to be needed. So although we can consider it, it is not always possible. Now, children who are ill, there's two different types of illnesses. There's the contagious illnesses, and you probably all have policies about children who can be contagious, like a high fever, or if they vomited, that they should stay at home. However, there's also the chronically or acutely ill, which is what we are referencing about medical conditions. These are medical conditions that are not contagious. And so we will be talking a little bit more about these. Most of these children will have medications that have prescriptions, and the prescribers or the doctors should specify what and when any of the medications or procedures need to happen while the child is in childcare. So the question is, can I dispense medication and carry out a physician's prescription and the doctor's orders if I'm just a family childcare provider? I am not a nurse. I don't have any medical training. Why should I have to do it? Like, do I have to? Am I going to be responsible? Like, what's happening? Well, California law and licensing guidance, if you are licensed to provide childcare in the state of California, that license is authorizing you, you are non-medical staff, to administer blood glucose monitoring for children who are diabetic, and to dispense inhaled medication. By being a licensed family childcare provider, you are also authorized to carry out any medical orders from a physician, such as, whatever's written into a medicine bottle or jar or ointment. You can carry those out, and also to carry out any medication or action in case of an emergency. Now, within that law, it's all in the California Health and Safety Code, which is law in the state of California. They also provide very specific forms that need to be completed by the doctors and for the parents to be able to carry out the orders and to be able to document what you are doing as non-medical staff in a family childcare setting. After today's session, you will receive an email from CCPU and Amanda's team with the Education Fund. You will receive a copy of this PowerPoint. When you open it, you will find the links to the forms will be live. So any of the forms that I speak about today will be sent out. You will be able to access them through this PowerPoint and also through a handout where they will be listed with descriptions of which form is applicable to what process. California law even allows non-medical staff to carry out orders for patients for gastrostomy, tube feeding, and even for insulin administration. So the fact that we don't have any medical training is not and will never be an excuse to say that you cannot admit a child. In reality, the child's parents and grandparents and aunts and uncles also do not have any medical training, and these are processes and procedures that they have been taught to do at home, and so can you. Okay. So very specific to glucose level, to inhaled medications, to emergency medication, even medication for seizures, and less conditions like gastrostomy tubes, you are, by the fact that you are licensed, allowed to provide them in your home without the need of having medical training. So this is a little bit, now I'm going to talk about addressing the individual needs while maintaining the health and safety of all the children in your care. Because this is where the decision to accept a child plays into the ADA or American with Disabilities Act requirement to truly justify that admitting a child with these needs will create a direct threat or cause a fundamental alteration to your program. I have had many different scenarios and I have not been able to justify them. But regardless of whether the child is going to be, but before you get to a point in the decision maker, whether you will accept or not accept the child, you have to consider all of these things, and you may need to make time to meet with the parent and gather as much information as possible before you make a decision to accept or deny the child's enrollment in your FCC. Keep in mind that as required for community care licensing, you must always have an adult appropriately trained in CPR and first aid at your FCC. That means that if you as the owner who is trained need to leave the children in your FCC to run an errand or to pick up other children at school, whomever is left with the children must also have valid training and must also know all of your emergency procedures. This is basic safety that must be in place at all times. Therefore, if you have any children who have prescribed medications or allergies or asthma, whenever you leave and you are not present at your family childcare home, you still have the responsibility of making sure that whoever is knows how to, again, administer the medication and knows all of your emergency procedures. Okay. If you want to ask a question, please go ahead and write it in the chat. We will not be responding to raised questions during the presentation. There's simply too many participants. So please put your questions in the chat. Community care licensing makes available for us a physician's report. As you see from the photograph that I took of this form, is Form 701. It is for childcare centers. Family childcare homes are not required to have this pre-admission of health evaluation signed off by a parent and completed by a physician. However, if you select in your admission policies to have this form completed, say within 2 months of starting to attend your program, you will be able to receive the information directly from a doctor that the parents may not necessarily share with you about allergies, asthma, insect stings, whether the doctor thinks the language is appropriate or not appropriate. This gives you much information about all of the children. If we're thinking about discrimination in the Americans with Disabilities Act, I would say all children who come to my family childcare home must have this form. That way, I wouldn't only require this for a child who has a medical condition. As a family child care owner and provider, whenever I give medication or accept a child who's going to need any kind of medical care, you need to have everything that is listed on this and the next slide. So you will receive, again, a copy of this PowerPoint with all the numbers to all of the forms. You will receive everything at the end of this presentation. So first of all, you want to make sure that you have the written and signed authorization from parents to carry out any incidental medical service or dispensing of medication for children. You have to have written authorization for each staff person who may give the medication. So if you are the owner, it cannot only be you, it has to be you and anybody else who may be at your home when the child needs the medication or when an emergency occurs. You need to have copies of the orders from the child's physician. That can be the prescription bottle. Sometimes it is forms. We will talk about that. Parents need to give you all the medication, equipment, and supply necessary to implement the services that you need to have. You need to obtain the specified training. So the parents are going to demonstrate and show you how to do things. When they do, make sure you write it down. You write down the parent name and you write down when they trained you, and you place that in the same folder where you keep your CPR and first aid certification. Okay? You keep that verification and you plan for at least one other trained staff person or adult to always be in the home if you're not going to be there. Make sure that you have storage that is safe and, if possible, lockable in a drawer or a cabinet that has a lock. And you follow all of the standards about cleanliness, using gloves if you need to, washing your hands before and afterwards, disinfecting surfaces. If there's any blood, any vomit, anything, that you use the standard cleaning procedures that we know have to be in place to prevent contagion between children. And you always have to have a record about when you give medications and who gave the medications. All of this, if you have established procedures, then it is much easier for when you are going to be, for example, accepting new medication, changing expired medication. And I'm going to be repeating this throughout the presentation with lots more detail. This is just an overview. Because we also need to meet additional requirements for emergency incidental medical services. So if a child is stung by a bee and they have a life-threatening allergic reaction, or if they have a seizure and they're supposed to have controlled seizures and they have medication at home, but they have a seizure in our care, what do you do in case of emergency? When you don't have any plans, you always call 911, always call the parent, and always submit an unusual incidents report to community care licensing. Because first and foremost is the safety of that child. However, there are some medical conditions where the doctor will say, just call 911 if this happens. Okay, so an incidental medical services plan is a document that we'll be talking about today that you have to have for your family child care home facility, explaining the types of medical services that you provide, the training that you have, and the procedures and processes that you have in place to maintain safety and make sure that the children are supported in all of their medical needs. The incidental medical services plan needs to be on file with community care licensing. Okay? So every site has to have a medication plan. What do you do with medicines? What is your procedure? If you're also going to have incidental medical services, it is a separate plan. You can put them both together, but it is a much more detailed plan. And by the end of this training, you will know the difference between the two and how to write one. We will be giving you templates. So let's talk about the different conditions that would require an incidental medical services plan to be written. So we have diabetes. If you have a child with diabetes enrolled in your program, you will need to measure their sugar. That's glucose monitoring and maintain logs. And following the doctor's orders that the parents give you, you would know if the sugars are high or low, if they want to manage it with meals and the types of food they eat, or is there going to be administration of insulin, either injected or through an insulin pump? If the sugar is too low, there may be a need to provide emergency medication that's called glucagon. And if you are using to measure the blood sugar levels, if you're using a little pen that has a little needle on it, you need to determine with the parents how you're going to be disposing of the sharps. The parents may give you a special container. As far as glucose monitoring, there's two ways to measure the level of sugar. One is you prick the finger and then you put the little strip in a machine and it tells you the level of sugar that the child has. More recently, more children are being fitted with a little device on their arm that just connects to like a little smartphone piece that you have somewhere else in the home, and you can see at all times what the sugar levels are without having to bother the child or use any kind of needle. The same with insulin administration. Sometimes children use insulin pumps and you don't need to worry about utilizing any needles. That is diabetes. And again, as a licensed provider, you're expected to be able to take on the responsibilities for glucose monitoring and for the emergency medications necessary if a child in your care were to need that level of care. As far as asthma is concerned, asthma can be triggered either chronic, where there's daily scheduled treatments because the child always needs them, or it's triggered by allergies or other situations like when they have an upper respiratory infection. Any of these inhaled medications could be either a nebulizer, like these top pictures, or inhalers. Nebulizers have a little container where you put drops of medication and they're connected to a machine that pushes the air out. The inhalers usually have like a little pump. Older children inhale directly. Younger children or new to inhaling may be given an extender. All of these situations make it so that, again, receiving training on how to administer inhaled medications in general might not be as helpful as receiving training by the parent specific to their child so that you learn what the child in your care needs, because every child is going to need a different frequency, a different dose. I was at the pediatrician 2 weeks ago and saw that there's now 20 different types of inhalers and they all work a little bit differently. So again, your training is going to come from the parents. The prescription of all of these medications is going to come from the doctor to the parents and to you. You must always have the medication in the prescribed bottles and containers that the doctors give families. As far as food and other allergies, the most common medical attention for this, if these are life-threatening allergies, is the use of an EpiPen. And these are, again, prescribed specifically for the type of allergy and for the size of the child in your care. And if they have the prescription label on them, you would know that it is like a little pen, and it is a single, it's a tiny little needle at the end, and you insert it into the child's leg and click, and that gives them the exact amount of medication, and then you put the cap back on it. It is for emergency use. The use of EpiPens is very common. We have many, many children who might need this. But if the child has a food allergy, say to peanuts, and you are very, very careful in your family childcare home, the child never has an allergic reaction to peanuts, it is very likely that the EpiPen would expire. So you need to have a system in place to check the medications that you have to make sure that before they expire, you ask the parents to replace them for you. The same can happen for a child who is diabetic with the glucagon in case their sugar goes too low. If their diabetes is well managed, it is very likely that you will never use the medication and that it might expire. So how about seizures? So you probably learned about seizures in your CPR and your first aid classes when you were certified. And you may have received information about what to do if a child in your care should have a seizure. They might have a seizure because they have epilepsy. They might have febrile seizures, or they might never have had a seizure and just have a seizure in your care. So follow, first of all, if the parents and you have no prior knowledge of the child having seizures, then when the child has a seizure, then you should proceed and call the emergency number and then the family. But if the child does have a history of seizures, they could be controlled or uncontrolled seizures. There's typically medication that is given either every 24 or every 12 hours, and it's usually given at home. But should the medication not work, what do you do? And what are the medical recommendations for action? This is the licensing form that you would want to give the parents to have the doctor complete so that you know what you're expected to do. I had seizures when I was a child. The type of seizures that I had were short, never lasted more than 2 to 3 minutes for me to come back to. I never needed to go to the hospital. My teachers were never told to call 911. They just called my parents. Many times I just kind of went back to the rest of my day. However, when I was teaching young children, I did have children in my care that had seizures where the doctor's indication was to call 911. So again, have the form completed and make sure that the parents and you all understand what you need to do in case of a seizure. There's other medical needs and incidental services that some of you already shared in the chat as we started the session today, such as tube feeding. You may or may not need to conduct tube feeding in the childcare settings. Sometimes children outgrow the need for the tube feeding because they have learned how to eat, but the doctors might have left the little button, we call it a button, on their stomach. And you may need to just make sure that it's cared for. So always ask and make sure that you have doctor's forms on how to care for children. I once had a little girl enroll. Parents said there were no concerns. And when she showed up, she had an oxygen tank. And I'm going like, oh goodness, she's got an oxygen tank. I didn't know she had an oxygen tank. You know, what do I need to do with the oxygen tank? This was like her first day. Mom was ready to drop her off and go to work. And the issue is this little girl had been in a terrible car accident as an infant, had so many medical needs that now the only thing she had was oxygen. And the parents didn't even think they weren't worried about it anymore. It was nothing to them. So they had not put it on the forms. That's why I go back and say, sometimes what is written and what is communicated to us as the childcare providers for these kids is based on the perception of the parents. And if you and your procedures decide to use the licensing form that is completed by a physician, and you get it within the first 2 months of a child attending your center, possibly even before they start attending your family childcare home, then you will always have a non-biased record of what the child's needs are, possibly before they even enroll in your care. So again, for anything that you do, you will need to follow, first of all, the doctor's orders. And anytime you give medication or it's an emergency, so EpiPens are always used in case of emergency. You always call, first give the injection, then you call 911 to make sure that the child is checked out by the paramedics as having responded to the medication that you injected with the EpiPen. Then you call the parents. After 911, you call the parents. And finally, when the event is all over, you have to file an unusual incident report with community care licensing. So again, the difference between emergency medications versus regular and routine medications is that those medications that you only give when there's an emergency will require you to call 911. Even if the child reacted okay and the parent says don't call 911, licensing recommendation from community care licensing is that you always call 911. So what is not considered a medical service? Wearing glasses, having to put a patch for a specific number of hours of the day on a baby's eye, so if they have a lazy eye, wearing a foot brace or special inserts in their shoes, having a walker, having a wheelchair, wearing hearing aids, or adapting foods because, they had to have all of their teeth pulled. None of that is medical. You do not need medical prescriptions or special permissions from community care licensing to be able to support children with this type of need. You would only need to make sure that the parent is showing you how to use and when to use the different pieces of equipment. For example, if you have a little one with a hearing aid and they pull it out, how do you put it back in? Just ask the parent to show you. You do not need a medical prescription to do that. So I invite all of you right now to really consider the communication circle around the child when there are medical needs for a child. There needs to be you really advocating for the child and knowing all of the forms and medical information that you need from the health professional. However, you and I would never communicate directly with the health professional. We would give those forms to the parent. The parent has the health professional complete them. The parent is always informed, and they would give you the forms. Again, with prescriptions, you have to have the prescription bottle or label with all the medication that you have in the family childcare home. So you can always tell parents that if the doctor is giving them medication, say for 30 days, and the children are going to be in your care for 12 of those 30 days, they can ask the pharmacy to separate the packaging, 30 dosages for home, of the 30 days, do 12 dosages for childcare because they'll be in childcare for 12 days, and the rest of the dosages for home for the parent. The pharmacies do that at no extra cost. So not having a prescription medication at your family childcare home without a label because the parent did not get 2 separate containers, it's not an excuse. If any of you have any questions about what is or is not considered a medical service or a medication, go ahead and write it in the chat. Amanda, Rebecca, and our interpreter will be taking the questions, and I will be pausing in a couple of minutes so that they can post some of the questions specific about the American with Disabilities Act, accepting children with needs, and what is and is not a medical service. So let's talk a little bit about prescription medications and medical plans. So even if you've never had a child with asthma or diabetes or a life-threatening allergy in your care, you have surely have had parents who have asked you if you can give medications while the child is in your care. You can, as a family childcare provider, say that you will not give over-the-counter medications to children. That could be part of your policy. However, if the children really need that medication and the parents want you to give that medication, I'm talking about non-prescription, I'm talking about a cough syrup, or maybe about children's Tylenol. If the parent wants you to give that medication while the child is in your care, you must have parental consent written down to administer that medication, just like you do for prescribed medications. It is the same process and procedure. Now, because the over-the-counter medications are sometimes recommended by doctors and parents need to go to work, I am recommending that you consider putting into your contracts and policies and procedures about medication right next to don't bring your child in if they have a fever or if they've been throwing up in the last 12 or 24 hours. Put right in there. If your child is going to need to take medications, call me and plan to have time to complete paperwork, because you will not be leaving your child and the medication with me unless you have signed forms and you have written into the forms how I'm supposed to give the medication. And that is this licensing form, 9221. And it is very specific because the parent is going to give the instructions about how they want you to provide the medication. And it has at the bottom a little chart where you're going to write down the doses and when you're supposed to give the medication. Okay, so again, the medical services and the medication have to do not with a disability, but actually giving the medication. So I could have, for example, a child in my care who might have Down syndrome and they don't need any medications ever. But when the child is very congested, the mom really wants me to give them Tylenol cold for babies. If that's what the mother wants, then the mother's going to have to fill this form just like they would for any other child, not because the child has Down syndrome, but just because the medication is needing to be given. This form is for short term because this chart is very, very small down here for just a few days of administration where you could write down when you gave the medication. If there is going to be long-term medications or procedures, then it is recommended that you develop a separate medication chart and log so that every day there is a log of what you do. So for example, if you're measuring glucose levels, that's going to be something that you're going to do several times a day, every day with that child. You're going to have a separate chart where you're charting all of that. Okay. Again, emphasize with parents that they will not be allowed to drop off medication with you unless the form is signed. If you have medications that are on an ongoing basis needing to be administered, you are responsible, I'm going to emphasize again, to check for expiration dates on medications, to let the parents know when you might be running out. And if for any reason you have a child who was given medication A and then the doctor changes it to medication B, you need to return medication A back to the parents so that you never have at your FCC a medication that nobody's taking, because it is just a liability to have it in your cupboard. So every family childcare provider needs to have procedures regarding medications written down. It is best if you give them to the parents at the time that you admit children into your care, just in case their child should ever get sick, so that there is no way to avoid and make sure that they know that if there's no way they can avoid the scheduled medication to be taken at home and they need to take it under your care, that you will need again to have forms completed, sometimes by the doctors and sometimes by the parents. That way parents are in a hurry, they're going to need to get to work, their child has been ill, possibly keeping them up at night, and giving them, stopping them and expecting to do all of this in the morning if they have no prior knowledge that that is what your policy is, will create a little bit of a difficulty in the relationship and the communication between you. Not only should you be writing down all of your procedures about medications, including where you keep them in the cupboard, making sure that they are locked, who has access to that cupboard, who else besides you would be able to give the medications. Make sure that everybody in your home also knows what these medication procedures are, particularly if you have a large family childcare license and you have other people helping you take care of the children. So when you are going to write down your medication policies, you want to make sure to go back to this slide, write a little note, it's slide 33 for when you get the PowerPoint, on what you should include. So where the medications are going to be stored, how you're going to maintain confidentiality about which children take what medication, who is going to be responsible for giving the medication or the breathing treatment or whatever it is that you need to give, where the medication logs will be kept, what forms and plans you're going to be requiring from parents that have assigned their signature and which ones that have been completed by the doctors. What safety procedures will you follow when administering medicines, like making sure that the other children in your care don't have a key, that they can't access the medication, that you're going to double check the name. Whatever your safety procedures are going to be, you need to write them down. Again, for what you will do, just in case there is an error committed, in the administration or in writing down the medications. So again, the responsibilities of the parents to make sure that you have all the necessary supplies on hand, and how you're going to be communicating with parents, whether it's going to be daily or weekly. That is all part of your medication policies and procedures, just for medication. Okay. So great list to double check and make sure that you have this included in your policies and that the parents sign off when they're signing the contract and they enroll their child in your care. This is a section of California Title 22 regulations, which are what community care licensing analysts and staff review when they visit your licensed facility. So as a licensed facility, you're responsible to follow the Title 22 regulations. Number B8 in this document is, so there's the little b, B8, this section down here, okay? This section is specific to the required information and forms that you need to have in every child, in the child's file, specifically if they have allergies and if you're going to be needing to have emergencies or medical treatment. So you have to have parental consent. And this is where that is stated, okay? Of note, whenever the regulations say medical professional, this means a doctor, nurse, or health professional that is licensed in the state of California. I mention this because I live in San Diego and we have many families who receive their medical care across the border. I cannot take that signature. It has to be somebody who is licensed medical professional in the state of California. Okay. Remember that children's records are confidential. Nobody should see anything that is in that file for that child, for their health, unless it is you and other adults that are helping you in your family childcare home who are also taking care of that child. They also cannot share that information with anybody else. The only other people that can see what's in that file are the analysts and supervisors from community care licensing should they visit your home. And of course, the parents of the child whose file we are speaking about. Okay. Whenever you have prescription medication, or even the non-prescription, if you agree to give, for example, cough syrup and the parents sign the forms, in your processes and procedures, say how you are going to let the parents know what time the medication was given on a daily basis. So if it's the medication, for example, for the cough, you may select to say in your processes and procedures that you will just tell the parents, or that you will give them a note, or that parents will have access to a notebook that says Lucia, where they will be able to see my sugar levels every day. But the parents and me and my staff are the only ones that know where Lucia's notebook is, not other parents, because of confidentiality. So you need to decide what's going to work best for you and how you operate your FCC about making sure that the parents have access to be able to see the information about their child on a daily basis and the medications or services that you provided. There we go. This is a different section of the licensing regulation. So where the arrow points, it states that you need to have a plan on just the log that I was speaking about. Who opened the storage cabinet, the date and the time the medication was taken out, the time it was administered, when it was returned and locked back up, and by who. And then to inform the parents exactly as I was just explaining. So again, there is no format for the log. You can just keep a written log in a notebook any way you want, as long as it has the time, the date, the child's name, the name of the medication, and a spot for you to sign that you were the one to give the medication. This is just an idea for safety measures, just because we all have 5 fingers. And so there's 5 rights meaning correct, for administering the medication. Every time before I actually give the medication, I will check, is it the right child, the right medication, the right dosage, the right time, and the right route. So is it swallowed? Is it chewed? Is it an ointment? Is it a breathing treatment? Just make sure that we have those 5. And anytime you have other adults helping you with medication, making sure that this becomes a habit to always double check and to always train everybody to write legibly on your medication log. Again, I wrote it down here: date, time, who gave the medication, medication name, etc. If it's an unusual event, such as an allergic reaction where you used an EpiPen, or an asthma attack, where this is a child where you typically would not give a breathing treatment to, and this was an emergency, always have another adult who is with you sign and acknowledge when you gave the medication. And if there's specific signs that you were told by the parents and the doctor to watch for before giving the medication, make sure that you go back and you write down what it was that you saw in the child that made you have that emergency reaction to give the medication. Even when it is not emergency, you always have to log any medication communication with parents about supplies. So in the same log, I would recommend, just because it's chronological, if you start running out of medications on the 25th of April, then write down a note. You know, Rebecca spoke with Amanda. Amanda said she would get more medication to me by next Monday. Just put it into that same log. So let's talk a little bit about just safety, supervision, and communication about just the medications. Again, they have to be locked and out of reach. You have to have a log. This is very important. If we are very concentrated on making sure we're following all of the safety precautions for the child who's receiving medication, we need to make sure that we are making provisions to make sure that somebody else is visually supervising all of the other children while we are tending to the one child who's receiving the medication. Some medications have to be maintained in the refrigerator, and we don't lock refrigerators. So make sure that you have a process where if medication is going to be refrigerated, that is done in a way that is safely stored and nobody has access to it but you and those who would otherwise also dispense the medication. If you have expired medications or a child stops attending your program and you are left with medications, there is a form that you need to complete describing how you are getting rid of medications. Or you can give them back to the parent and the parent can dispose of them. So these are the very specific Title 22 regulations about the personnel requirements. That means that when you accept a child who has to have a medication or a medical service, such as testing blood or using an inhaler, you have to make sure that yourself and any other adult who is going to help you has the training necessary to provide the services to meet the needs of the child. Okay. This is that observation of all the children in attendance all the time. This is what causes most problems when we engage in supporting children who have medical needs. Is not the child with the medical needs and the service for medical needs that becomes an issue, is that the other children might get into trouble or have an accident or something might happen because we forget that they need to be watched 100% of the time. Okay. If a child is injured in any way other than a minor little scratch or cut because they fell in the backyard kind of thing, you need to notify the child's authorized representative. This means their parent or whoever the custodial adult is that takes care of the child. So if you have a child who you think is having an allergic reaction to one of the foods and that's not part of what was in the file, notify the parent, have a conversation with them. And again, your admission policies, every child care center must have admission policies in writing and available to the public. So your medication policy, what you do, children get sick all the time. So make sure that you include your medication policies in your admission policy documentation for families to be able to review. And again, if their child gets sick, they would then have advanced knowledge of how you're going to manage their child's medication while in your care. Next thing I'm going to do is I'm going to ask you to reflect. I'm going to ask you to take out a piece of paper, and I'm going to give you approximately 5 minutes to write down what policies and procedures you already have in place, What staff training and parent communication processes about medication and medical procedures do you already have in place? And based on what you heard today, what do you feel you need to go back and revise? It's your little to-do list. And what do you feel now that you have to create from scratch because you don't have in place at all? So please take out a piece of paper and write down all of this.
Lucia, can I make a quick announcement?
Yes.
We will be doing break-off groups later in this training. And I would like to ask that if you would like to be in a break-off group where the language is Cantonese, if you can please put your name in the chat or raise your hand or come off mute and let us know closer to the time that you would like to be in one of those groups.
Thank you, Amanda. The breakout groups will be right after you write these thoughts down. So again, if you want to be in a breakout group and you speak Cantonese, so you can speak with other Cantonese speakers, write your name in the chat or raise your hand so Amanda may put you in the Cantonese speaking group. And I'll give you about another 2 minutes to write down your thoughts and your reflections before we go into breakout groups.
And you can also come off chat and let me come off mute and let me know that you would like to be in the Cantonese group if you cannot raise your hand or put your name in the chat. Thank you.
Can I please speak? Can I please speak?
Yes, did you need to be placed into the Cantonese speaking group?
No, I've been asking some questions and I have received the answer in Cantonese. I don't speak Cantonese. And I also want to clarify that my name is Ana Comayagua, but I'm using my daughter's computer, which is Gabi Comayagua. It's a confusion that I've been taking, that I'm receiving the response in Cantonese, but I do not speak Cantonese. Thank you.
Yeah, so thank you for that question. And what you see in the chat is that the chat is being translated so that every message is appearing both in English and simplified Chinese so that everybody can read what's in the chat. We have not gotten to the answer section yet of the workshop. So your question has been noted and will be answered later on in the workshop. So the simplified Chinese you're seeing is a translation of your question, but is not an answer. Thank you for asking.
Thank you, Amanda, for that clarification. I am not sure if we have the names for the people who wanted to remain in the group in Cantonese, Amanda, but I think it is time for us to move on to the breakout groups. So Amanda and Rebecca will be assigning everybody to go into a breakout group of about 4 people each. You will have a little message pop up on your screen and you will click on it to join that breakout group. When you get to that breakout group, if you don't already, please turn your video on so that you can actually have a conversation with the other 3 or 4 people in your group. And what we want you to do is we want you to go ahead and talk about what you just wrote down, about what you have learned, what policies and procedures you have in place, and what you feel you have learned that you need to go back and start doing. So are we ready, Amanda?
Yes. Hold on 1 second. Sorry, having some technical issues here.
We will have until 2:35, and at 2:35, we will close the breakout groups. So you have about 10 minutes to share with each other. Thank you very much. So if you click the globe in English, you should be able to hear me just fine. If you think there's a volume issue, it's probably because you did not click that globe to English. I am going to ask maybe just two of you, because we don't have too much time, if you would be willing to share a little bit about your group discussion and what you are going to be doing with the new information. And what you have learned so far today. If you want to raise your hand, then we will unmute you so that you are able to share with the whole group a little bit of what you discussed from your reflections. So to raise your hand, you would also go to the bottom of your screen and click on the three dots and raise your hand so that we know who wants to speak about these 4 items. Okay, Kathleen Brown, your hand is up and you're clapping. So go ahead.
Sorry about that. No, I just want to say, before I was trying to get licensed, I was just like, family, friend, neighbor, provider. And I did not realize this until I started trying to get my license, that we need to have all these necessary forms. So when the parent brought the child to me, and he would have like, child with his asthma, I didn't know how to do it, so I would have to call her so that she could do it because I was not familiar. So it really opened my eyes on how I have to be careful. And another lady in our group, she was explaining how she developed her own form or her own paper in order to protect herself as well as, the child. So I found it very interesting. And also I'm learning, the more we have these little discussions, I'm really appreciative for it. So I thank you all for having this and bringing it to my attention.
Thank you, Kathleen. I'm glad to be able to present this, and I will continue to present more resources for all of you so that after today you have those at your fingertips. I know, Gabi Comiagua, you said you're using your daughter's computer, but that's what's coming up, but you're going to speak next for just a couple of minutes. Let us know what your thoughts were on this reflection activity.
Is it my turn to speak up?
Yes.
Thank you. I'm so sorry, but I'm with computers. I'm very expert, but I'm trying my best. Yes. Thank you. Definitely. Thank you for the class. I've been, some information is being coming back to me, and some things that I already, know, but it's good to refresh your brain, after taking this training in a long time. And definitely, I do have the forms about implementing, giving the medication. And what I have is a new one. I give one at the beginning that is on the forms that we sign, to have it already signed in case we have to give the medication for any reason. And also it has all the information that, the date, the time, and check the bottle if original, and all those precautions that we have to follow. But I'm gonna definitely go back to the PowerPoint and review the forms, because there is one that caught my attention about we have to post it and follow it. Those forms really helps to guide the process. And thank you so much. I'm not going to take more time.
Thank you very much, Gabi, for also sharing. And like I told Kathleen and all of you, my hope is that you have everything at your fingertips by the time we finish today, so that you can keep moving forward to not only take care of our children and provide everything they need, but to do that in the safest way possible for them with the least amount of liability for you. So as I move forward, I am now going to talk about the incidental medical services plan. So remember at the beginning, I said we have to have a medication policies and procedures, and that's part of your admissions. But then there's also this requirement to have an incidental medical services plan in place with community care licensing. And it basically, if you are a family child care facility that has the intention of providing incidental medical services, then you need to have a plan in place that's very specific to those services beyond the routine medications. Typically, if you have a new application, so if you were or are a family friend and neighbor provider, and you are putting in a new application, right away with that application, you could write up your medical procedures, your medication procedures, and an incidental medical services plan that I will explain a little while ago, and you just do it all at the same time. And that way community care licensing knows that you have gone through the trouble of really thinking about all of the precautions and all of the requirements to maintain your family child care home the safest place for all children, including those who have medical needs. If you were already licensed and you didn't know about the incidental medical services plan, then you would just write it up and send it to your local licensing office with your license number and asking them to just add it to your paperwork. Because you don't want to have something happen because you were providing, for example, inhaled medication or an emergency shot for an allergic reaction, and community care licensing not even being aware that you knew how to take care of that you had taken precautions, that you have processes and procedures in place. So that's the reason for that. You want to make sure that they know as much as you know. We've all seen news stories, so you don't want to be part of a news story. Make sure you complete your paperwork and you file it, okay? So the types of incidental medical services, again, these are not necessarily medications, they're services, is like I've said before, is the blood glucose monitoring, or giving the EpiPen when it's for an allergic reaction, or giving the glucagon when the sugar is too low, or taking care of gastrostomy tubes or insulin, emergency anti-seizure medication. These are things that are conditions that children have. They are not a passing illness, right? And so how you're going to take care to support the children through these conditions requires the incidental medical services plan. So even if right now I don't have any children who need any of these things, I need to have the processes and procedures in place in my family child care home so that community care licensing and parents know that I am ready to serve and maintain the safety of all children. So even if you have the intent to become trained and to provide beyond medication, the medical services, you need an an incidental medical services plan. Community care licensing issues provider information notices, or PINs. Provider information notices. When you get this PowerPoint, you'll be able to click on this one. This one that they issued, the number is 22. It was issued in 2022 in February. And this is for childcare. So it's CCP, childcare providers. This one document is about 6 pages, and it has live links for all of the forms that you need to complete regarding medical services. They put everything. It's like if you wanted a summary of everything I'm telling you today, it's in this PIN 22-02-CCP. In this PIN, community care licensing has said that if you're going to be measuring glucose or providing inhaled medication, you don't, if those are the only incidental services that you're going to provide, you don't need to use a plan. You just use the forms that they have linked in this document for you. And the parents complete those forms with their physicians and they give them to you. But anything else other than blood glucose testing or providing inhaled medication, you do need to have the incidental medical services plan developed. So the information that is in this PIN for incidental medical services also says that you have to have all of these things in place in order to be able to support children with medical needs. And I have already spoken about all of these, so I'm not going to stop right now and detail them. I am providing this more as a summary to you when you get to this point and you're reviewing the materials when they get emailed to you, right? So how do you develop an incidental medical services plan? We have a couple of things, and Amanda is going to be putting the links in the chat because we developed a template and also a sample for you to be able to see what one looks like. Now, we're going to be sending to you, it's a sample. Don't use it specifically because it was just made at random. It's not for any specific setting, but it's just for you to be able to see what it would look like. And so Amanda will be placing the links in the chat. We also translated it into simple Chinese for our Cantonese speakers, because when you're talking about developing a plan, if you speak another language, you might want to develop it in your primary language so that you have full understanding of what you are writing down, and then have it translated into English. But basically, in the plan, you're going to write your FCC name and include your licensing facility number. You're going to call it its Incidental Medical Services Plan, and you're going to put the date. Then you're going to introduce and say, you know, incidental medical services will be provided by the staff at whatever the name of your ACC, including, but not limited to, like, who's all the staff? You as the owner, your husband, your sister, the assistants that you hired if you're a large, if you have a license for a large family childcare home. You modify this list according to what aligns with who you are and what you do in your family childcare home. Then there's a narrative. So it's going to be best practice for an FCC to include, first of all, the types of incidental medical services that you're going to be providing. Again, you don't have to say anything about inhaled medications or glucose monitoring because there's licensing forms for those. And that's where all those steps will be for glucose and for inhaled medication. But for anything else, for example, if you're going to be providing emergency injections for life-threatening allergies, you would write that down and you would say, I have a medicine cabinet, it is locked. This is how I keep the log. Like all of those pieces that you have in your medication processes, you would put here. So what I have seen people do is if you have a medication plan, you start number 2, that's on the screen that says plan for ensuring adequate number of designated staff trained. First of all, you need to make sure that all of you and everybody know about just medications in general, because everything that you do then with an incidental medical service would have to be following those same precautions. You still have to do logs like in medication. You still have to keep them locked. You still have to communicate with the parents. So again, these go hand in hand and can be included. You can follow those same precautions for those. And also by having a written down plan, if you have somebody new coming to help you, then you review this entire plan with them, or you have them read it. It becomes kind of like your little training manual to make sure that everybody is safe. Now, anytime there is a change to your incidental medical services plan, you would need to revise it and send it back to community care licensing, just so that they know that you are prepared and ready to support the health and safety of the children. So you're going to have to specify the types of incidental services that you're going to be providing. You know, if it's going to be tube feeding, if you're going to be accepting children who have seizures or who need emergency medication, you would just list all of the pieces, and then you would list what types of doctor forms and records are you going to require the parents to give you? How are you going to store the medication? How are you going to train everybody? You plan for ensuring precautions are in place to dispose of medications or needles, how the parents are going to be informed anytime you have to provide the medical service or if there's an emergency, and then how you're going to be reporting to community care licensing any unusual incidents. So again, these pieces we already talked about just with basic medications. They are also applicable to the incidental medical services. So you would also, if you're going to be using any personal protective equipment, you need to write that down. You know that you have, when you were licensed, or if you're in the process of getting licensed, you had to develop an emergency evacuation plan, right? With an evacuation route. What the incidental medical services plans require you is to write down, because these are children who need medical care all the time. You need to write down, if I have to be evacuated. And unfortunately, we have many areas of our state where we've had evacuations due to floods and fires in the last 2 years. So if for any reason you and other children in your care have to be evacuated, you need to write down what your plan is for transporting the medication and the equipment and the supplies from your family child care home to the location where you are relocated. And the reason for writing it down is we want to make sure that there is a plan, that you are never caught off guard, that whenever the children are in your care, wherever you are with them, you can continue to support them with whatever medical needs they might have. And then you also write down, what is your process for notifying the parents when their child receives medication or treatment? So for example, if I have diabetes and you have a little notebook that says Lucia, and in that notebook, you write the date and the time and your initials and the glucose level that I had, then how are my parents going to have access to that notebook? So you could say there's a special shelf where we keep this information, and parents only have access to the information for their own child. So word of caution, don't keep one notebook with all of the children's information in it, because the parent has a right to review anytime you wrote down when their child received medication or medical treatment. But every child also has a right to privacy and confidentiality. So if you only have one running list with all of the children and the parent has to see it, they would inadvertently see information of other children, which is not allowed by law. So make sure that you separate the logs by child, and that you describe in your incidental medical services plan how the parents have access to their own child's information anytime they want it. And of course, always write down how would you report any unusual incidences and emergencies using the unusual incidents report to community care licensing. By submitting an incidental medical services plan, you are always prepared. You always have everything in place. If you already have a child in your care for whom you are providing incidental medical services, such as glucose monitoring or inhaled medication, and you do not have an incidental medical services plan in place, when you get this presentation, you can just look at the forms here for nebulizer care, for blood glucose monitoring, use those forms, okay? But if you're going to be open to accepting children who need emergency medication, children who need gastrostomy tube care, you will need to write an incidental medical services plan and send it to community care licensing. Again, when you get the slides, you can click on the provider information notice and get the link to the forms right there. You can also go to the California Department of Social Services website and search for these forms by number in case for any reason you're not able to click on the links that we provide you. So this first form is the consent for medical treatment. This is the form that the parents have to sign anytime they want you to give them medication. Excuse me, for medical treatment, for procedures, and to call 911, any emergency that you do. 9221 is the consent to give medications, and it has a little medication chart as a sample at the bottom. This is again for inhaled medication, nebulizer, blood glucose, gastrostomy tubes. These are forms that the doctors would need to complete. And then this last one is the one that you always have to send to community care licensing in case of emergency or if you provide emergency medications such as the EpiPen. On the next page, I listed more forms for you. This is like any form that I mentioned before today. They're all listed in these 2 slides so that you would have a place to find all of them. Okay. So 702 is a form that you give to parents and they put in their child's health history. 701 is the one that you ask the parents to take to their doctor and their doctor completes. When you look at both of those together, you get a really full picture of the child's overall development. You know, the one that the doctors complete sometimes say, for example, that they failed a hearing test at their pediatrician checkup because they had ear infections. Maybe the parent doesn't mention anything about their child not speaking clearly, but then you notice, because you're experts in child development because you're with the babies all the time, and you notice that maybe I'm not speaking as well. And when you go back to look, my physician's report said that I had had too many ear infections and that the hearing test hadn't been completed. So then before you start assuming anything big, you kind of go back to the parent and remind them that they might want to take me back and see if my ear infections have cleared and what my hearing is looking like. So these 2 forms are just for all children in your care, even if they don't have a diagnosed medical condition, would be good to use. Again, the unusual incident report that you have to file with community care licensing. And then these last 3 forms are just items that I always appreciate having. This one is just a list of all the forms and records that you have to have in your family childcare home. So again, a reminder, you probably went through the licensing training when you initially were licensed, but there was so much information in those trainings. This is a good just checkup, like what do I have to have in place? The next one is everything that has to be in each of the children's records. And the last one is what they're going to be looking for in your facility. Like, do you have a licensing board? Do you have an evacuation plan? That would be everything that's on the 3rd one. So again, if you just do kind of checks and balances for yourself, I would recommend that you look at those last 3. If you're interested in having access to a legal question and answer session on the American for Disabilities Act, and you're the children's rights to receive medical care while in your childcare setting. This is a question and answer, and it is available in English, Spanish, and simple Chinese. Okay, and so I have seen some questions come through the chat about, well, you know, we have some people participating that might also work part-time, like at a childcare center where they have said that they will not give any medications. Is that legal or is that not legal? You may be able to find the answers in here and be able to share this information with others. I am not an attorney. I am not a lawyer. I can only give you information today, but this link here is legal guidance, as is this letter about administering medication in California in childcare settings. So if you wanted to ever share this information with anybody, I wanted to make sure you had it. And then of course, Amanda went ahead and put the links to the handouts in the chat for you to be able to access it. So next week, Amanda will be emailing the PowerPoint along with all of the materials. So the materials would be just like the PowerPoint. There is a one-pager that has all of the forms with all of the links, and then the sample incidental medical services plan and the template for the incidental medical services plan. They would both be available. So we know that we talked about disabilities at the beginning, and I want to make sure that we understand that you may have children who have disabilities and are enrolled in your program. You might have a child who has autism, who has a diagnosis of attention deficit hyperactivity disorder, ADHD. These are all different disability conditions that do not require an ongoing medical services plan. A child with ADHD may require you to give them a medication if they are being medicated, like at 1 o'clock every day, and you would just follow your medication procedures, right? So having a disability that makes a child eligible for special education services or for therapy does not mean that that child also, that you need to include that disability in your medical, incidental medical services plan. So I'm going back to the beginning of this presentation when I said that for different areas of government, disability is described differently. And for the American with Disabilities Act and discriminating against accepting children with disabilities into programs, the government has decided to include medical conditions, just like they include disabilities, developmental disabilities or physical disabilities. However, when it comes to developing an incidental medical services plan, it is only for the children that have, or for the conditions that are chronic medical conditions for children, not for the disabilities in general. And I just wanted to make that clear. So you still have to have, if you have infants, regardless of whether they have a disability or a medical condition, we still have to have those individual plans for the infants. When are they fed? When are they burped? When are they changed? When do they take a nap? For how long? The only thing that I do caution when you are accepting of children with various ability levels and possibly physical limitations is consider your evacuation plans. And if you have a child who developmentally does not follow instructions very well, or will not go with a group in case you have an emergency evacuation, that you plan for that. So if you accept a child, in addition to the children who have the medical condition, and now you have to take your medications with you, right? You also need to plan for a child who uses a wheelchair, who has a walker, who may have autism and may not understand you well enough. And so I advise you whenever you have the children in your care, think about what's going to happen if I need to evacuate in a hurry. Who is going to be helping me? And write down whoever's going to be helping you, add that to your evacuation plan that you post so that parents and community care licensing, should they come to do a site visit, all know that you have planned ahead. And lastly, if you have children who have developmental disabilities and they receive special education or therapy services, either through California Early Start or the regional center or the school system, many times you can ask the parents if they would allow you to communicate or ask their teachers to maybe, or therapists to maybe give you or send you some tips on how to handle behavior or developing better language, or how to modify things when they are in your care. Some of the infant programs across the state, when children are between the ages of birth and age 3, some of them provide services in the home, and some of them may even be able, with parent approval, to come to your home and teach you how to work with their child. But this is all about children who have other disabilities. It could be concurrent with diabetes or with asthma, but it is not the same thing. Like, they would qualify for the special education because of that other developmental disability, not because of the asthma. Okay. Along those same lines about children with other disabilities and equipment and being safe, there is again, statute language in California Health and Safety Code that says that postural supports can be used as long as the use of restraints is limited to what children need in order to be safe. So again, down here it says that the department, meaning community care licensing, needs to approve the use of supporting restraints only after the appropriate fire clearance has been secured. So if you have any equipment in your home, or the children come with equipment, they all have to have the restraints that can be quick released in case of a fire, in case of an emergency, in case the most common emergency with little ones is they're starting to choke and they're tied up in their high chair, that type of thing. So make sure that if any devices, anything that you're putting children in so that they don't fall, can be quick release. And you need to be very careful, because if these are elements where children are tied in or tied down, community care licensing may say that you need to get the fire marshal back out to your house to be able to verify that these have quick release, like the wheelchair belt or the little belts in here, and get permission from the department. So just be very careful about how you use straps. Again, there's two mindsets on this. Number one is that it could be interpreted that you're using straps to tie children down, which no, I don't even want to go there. I not even think that anybody would do that, to tie down a child just so that they would behave, right? So never, that's like a never. The reason for this approval is just to make sure that in case of emergency or evacuation, that you can remove a child and just pick them up and move quickly. So that's the quick release. Okay. So now, how to speak with parents about the inclusion of children with special needs or with medical conditions into your family childcare home. This is not the topic necessarily for this training, but it always comes up. So what I want to say is that the best way to be inclusive is to always have proactive communication, and always communicating your policies that you are open and welcome to all children. And all children at different points in time are going to need your attention in a different special way for them. For some, it's more frequent, for more is less frequent. But in how you advertise, how you put together your welcome message, how you print your admission policies, again, the tone and how you say that you are welcome and open to all children, including those who might have special medical treatments or disabilities, and you have that in all of your forms, all of the parents would know that at any given point in time, their child is going to be in care in your home and learning empathy and learning about other kids who look different, speak differently, and behave differently and have different medical needs than they have. So again, just proactive, making sure that your materials and your communication is always open. If your medication plan and your incidental medical services plan about how you are ready and prepared, and you know which forms are going to need to be completed whenever parents want to have medication given at your center, at your home. If you're going to be taking care of any children who have medical needs, put that in as part of your enrollment procedures, information that the parents have to read, information that the parents take with them when they enroll. If parents have all this information ahead of time, then all you have left is just to be very welcoming and opening of parent inquiries. Just be open to questions for clarification and share as much as you can with parents using that people first language that I spoke to at the beginning, but always remember about confidentiality. And so remember that if one of the parents comes to you and says, "What's wrong with Lucia? How come she never listens to you? She's always looking the wrong way. She's always doing, whenever I bring her in, she's always throwing a tantrum. When I bring my son in, she's always throwing a tantrum. What's wrong with her?" Again, just be open to the questions, and you cannot really say what's wrong with Lucia, right? You can have statements like, "I can see how that can be bothersome, and we're just accepting of all children, and we'll work with all children. And for some children, their day is a little bit harder than others. And so, I'm taking care of that, or I'm having conversations with Lucia's parents about it." But that you can't really say anything about my condition, whether it's a disability or a medical condition, because of confidentiality. Okay. If parents have questions about you taking care or spending more time with the child because they have a medical condition, you might want to explain about supervision and how you have a plan, and send them back to your enrollment paperwork where you gave them a copy of your medication and incidental medical services plan. And it explains that at no point in time are any children left unsupervised because you're taking care of a specific child. These are some quotes that I wanted to provide all of you in case you wanted to include them in your messaging or in your welcome materials for families, or even just to write them down where families see them. Children with disabilities or delays benefit from quality childcare just as much as children developing typically do. Children who are typically developing also benefit from interaction with children with disabilities or delays. And all children and families want to be accepted and included in their communities, regardless of ability. So at this time, we have a few minutes for questions, and Amanda and our translators have been collecting all of the questions that you have placed in the chat. And I am now going to ask Amanda if there are any questions that she finds that were common threads or common themes, and maybe we could answer 2 or 3 questions before we close the presentation at 3:30, Amanda.
Yes. And I also would say that we didn't get a ton of questions in the chat. So if we want to do a little bit of an open Q&A as well, that might be beneficial. So I do have one question here that says, is it mandatory to allow at your facility to work with a child, for example, who needs speech therapy, and the parents don't want them to provide that at their home? would it be extra liability to providers and insurance coverage?
So there may be different reasons why it's not provided in the home. I will let you know now that most therapies, I was a special education provider for over 18 years. And I worked during the workday. And if I gave therapy or I gave services, it was during the workday. Well, unfortunately for many children, their parents are at work the entire time that the services are provided. So they need you. They need you for the sake of their child receiving that early intervention to be to having that therapist come to your home. There is no liability for you to have that therapist come to your home. In fact, if you observe that therapist working, you might learn a few things and start adopting them in how you work with all children in general. The only thing that you do need to have caution about is that that person coming in is not, if you are a licensed provider, that person is not in your license as somebody who was fingerprinted. They are fingerprinted either in the therapy agency or the school agency where they were employed. And so when they come to your house and they're going to be working with little Lucia, they need to do so where you can see them, because you are still responsible for the visual supervision of that child, because that other adult is not part of your site license. That would be the only liability. Okay, so open your doors, welcome therapists, welcome specialists, all of us working together, everybody gains. Just be aware of your site license and making sure that children are only and always supervised by somebody who was fingerprinted and their name is part of your licensing documentation. Okay.
Thank
And
you.
do you have any other questions, Amanda?
Yes, somebody asked, can we get reimbursed for taking care of a child with special needs?
So there are different reimbursement systems for children with special needs. If you have an alternative payment voucher, you can speak with that alternative payment voucher entity, because there, I believe, and I'm not 100% sure, that might be a different rate for a child who has a disability, but I'm not 100% certain. Typically, there is no additional compensation for taking care of children with disabilities unless there is a state or a federal compensation. So if you're part of a family child care network that receives either state or federal subsidies, I recommend that you contact them, because rules on funding have been changing very quickly in the last 2 years to support inclusion. And in that, there has been more money made available for those subsidies. And I hope I was able to answer that question appropriately for whoever asked.
I have another question here, Lucia.
Mhm.
What if a child has allergies? What do we do? Do we need to have something from over the counter?
If a child has allergies and the parent expects you to do something about the allergies, I recommend that you give them the forms for the physician to recommend whatever it is that you're going to need to give to the child. Some pediatricians will give over-the-counter remedies for very mild allergies, but you would still want to make sure that the parent has not unilaterally decided to, I am going to stop sharing so I can see all your faces, has not unilaterally decided to medicate their child, and possibly you carry the liability. So always document, always write down, make sure that the parent is signing the forms. And you cannot give any medication unless the parent requests you to give the medication and they give it to you either in the original packaging or in the prescription bottles, and all the paperwork is signed. And some of that I'm thinking is probably has to do with allergies like a runny nose and things like that, when the parents just say, oh, it's just an allergy, just give her this syrup. Again, you can ask the parent to give it at times when it is not necessary for you to give it at childcare, or have them signed. Any others, Amanda?
Those are, that was the last of the ones from the chat.
So if you have another question that you would like to have answered, keeping in mind there's about 70 of us on this call, if you could raise your hand and maybe as briefly as possible state your question, and I will be calling on people until we run out of time. Okay. Gabi Komawa.
Yes, my name is Ana Komayawa. It's okay. It's okay. It's my daughter. Quickly, like you said, going back to allergies, I believe that a child, let's say that we don't have allergies, but if suddenly something caused an allergy while the child is in our care, my concern is to have something and do something. And that was one of the questions I submit. And I don't have anything. And then when you said about over the counter, what is allowed for us to have and give acting at that moment for the allergy? Of course, we're going to call parents, notify, and quickly get the response that we are okay to give it, permission to give it.
So depending on the allergic response, you have the responsibility to decide whether you're going to call 911 or call the parents. There is no medication over the counter permitted for you to give to any child, not even Tylenol, if the parent has not requested it and signed the forms. If you do it, it's going to be a liability.
No, I believe I will never give anything without a consent. But my concern is if, for example, a bee outside, boom, we don't know about his allergy, and then it's extreme. So 911.
911.
Thank you.
And then whenever you do 911, remember 911, first call, second call parents, and third, you complete the unusual incident report for community care licensing. Any other questions?
I saw Denise had a question.
Denise is raising her hand physically.
I want to go back to the payment for special needs. And you said we need to contact our subsidy programs. Okay, so, I do have special needs children, and those are children that I have assisted the parents through Social Security to be to get payments. But is there a list? Because I know there's a difference between special needs and not special needs, according to what I just heard from you. So is that going to be in the chat? Is there a list so that I can match it? So if I'm due some extra money, I'd like to go get it.
It's a very complicated system, Denise. And so children that qualify for special education services in the schools, for example, and they have an IEP, they don't necessarily qualify for SSI. So every type of public service has different eligibility. So that's what I'm saying. If as family childcare providers, if you work with a Head Start, if you're like a Head Start family childcare provider, or you have a family childcare network with the state, or if you use vouchers, then connect with the agency that is giving you those subsidies or that is paying you for that care, because they all have different rules.
Right.
And whereas a few years ago, there was no extra payment anywhere, you may find that if you go back and ask now, there may be some, because inclusion has been at the forefront of everybody with funding.
Okay, it's inclusion. Okay, I'll ask that, because I've been working with speech therapists. They come into the home and I've been working with them. And then I I processed the paperwork to get the SSI started. So if that's for me, I'll check it out. Thank you so much for that information.
You're welcome, Denise. And again, when I'm talking about vouchers, that means that the parents qualified for a subsidy because of their income. And so those are the types of subsidies. Okay.
Yes.
Thank
Okay.
you. Any other questions? We have like 3 minutes left. So hearing none, I want to just thank you for the work that you do, for your commitment to children, for your commitment to families, and for giving up your Saturday afternoon after working all week with children, plus everything else that you do in your homes with your families. Our children are so much better off because they have all of you caring for them, but also caring enough about yourselves to learn continuously so you can do a better job in caring for our children. So from the bottom of my heart, my heartfelt appreciation to all of you for being here today. And I did see 2 hands go up, even though I said my goodbyes. So I will probably only have time for one of the 2 questions. Is it Gina or Jania Greenwood? You raised your hand. Are you there? Okay, she may not.
Hello?
Oh, there you are.
Hello?
Yes. Did you have a question for us?
Okay. I don't know if you can hear me. Yes. Do you have some information how a parent can receive childcare services for their child? Well, I know a parent has twins, and she's on something called IEP or something like that. How does she go about getting childcare services for her twins?
Okay, so there's 2 pieces for childcare services. Every county has a childcare resource and referral agency. So write it down, childcare resource and referral, and they can help with finding childcare and childcare subsidies, even if they're already in your care. If the child needs to have early intervention and specialized services,
Yes.
we actually just had a training last weekend from the CCPU Education Fund on observing children who have developmental disabilities and how to refer children. So if the children are 3 years old or older, the parents need to go to their school district. If they are younger than age 3, they need to call the regional center on developmental disabilities that is in their region. And I'm so sorry, this is such an important question. This is what I did for 20 years of my life as a career, and I hate to do it in 1 minute, but that's like.
Oh, okay, that's okay. They're 9 years old.
Yeah, so if they need special education services, then that's with the school. The school district would do it.
Okay. Okay, thank you.
So it's 3:30. Thank you very much again for being here today. And I didn't know if you had any last words, Amanda, or reminders about when they will get the materials.
Yes, thank you everyone so much for joining today. We will continue to do this training along with other trainings. So please visit the CCPU Training Fund website and go to workshops. That's where you'll see all the workshops that we'll continue to offer. We will be sending a follow-up email out next week that will include the PowerPoint as well as handouts. We were also filming today, and so we will be posting this recording in the future as well. Thank you everyone so much for joining today.
Thank you.
Thank
Thank you
you.
very much for the good class. Have a nice weekend, everybody. Thank you. Bye.
Bye. Have a nice
Thank
evening.
you. Have a nice
Thank
day,
you so much.
everyone.
Have a nice
Bye. Have a great
weekend.
weekend.
Have a good weekend.
Thank you.
Bye.
Welcome. Bye.
Nice weekend. Thank you.
Bye-bye.